So this was another patient that was referred to our office from their general dentist, and lower right first molar. I had a deep cavity and a filling placed about 6 months prior. And all of a sudden the patient started developing a cold sensitivity and kind of a lingering that just it wouldn't go away, and spontaneous pain throughout the day, keeping her awake at night. And finally, after realizing that this wasn't going to go away on its own, or an antibiotic wasn't going to take care of it, they decided to get it taken care of. So the patient was referred to us, and again, we used laughing gas to help relax the patient, and we treated this with the GentleWave, and there were just some cool little hiccups. On the x-ray here, you can kind of see that this main canal kind of comes down here, and then all of a sudden the kind of the density changes. So we know whenever that happens that there's a split of those canals, and this happens quite often in the back root of molars. There can be all kinds of different complexities and communications more than halfway down sometimes, and sometimes our rotary files just cannot get into those spaces and thoroughly clean these kind of anatomical spots. So this was one where you could kind of see about halfway down there was a split there, and our files weren't able to get into that. And what was interesting about that is on our mid-check film, the GentleWave had already thoroughly kind of cleaned that canal space out. We weren't sure kind of where we would be, but that allowed us, and then it joined back together at the tip of the root and then split again. So it was kind of like this main canal kind of split, joined together, and then split again. And there's just no mechanical way of using files to treat that kind of complex anatomy. But our GentleWave was able to do it, and was very happy with the little check film here. We saw some lateral exits again. Probably there's 1, 2, 3, 4, 5, 6, probably 7 or 8 on this case alone, which always makes us happy to see. And then this was the final x-ray. And another key component of what we enjoy about the GentleWave is that we're able to minimally instrument and save very important tooth structure. And this patient was asymptomatic the next day, felt better, was sleeping, and was able to start chewing on the tooth as well. And it was just kind of another cool case of being able to clean out this tooth without having to instrument with files that had to go deep down into this root canal system.